You may recall the saying, home is where the heart is. For travel nurses, home...
Honestly, home is where they make it.
Heather is a nurse and recruiter for travel nurses.
Previous to that, I was a pediatric ICU nurse, so I flip in between both.
Logan May, familiar with the position as well.
I think it just the appreciation for the travelers. You know, when I was a nurse before, I just did my general nursing. Even when I was a travel nursing, it was staying here. COVID has completely changed what travel nursing is for what you're supposed to do. And I think coming out of that and seeing what these nurses are doing every day, the PPE is exhausting. You're taking it off, you're putting it on, you're having to remember the steps of taking it on. And that adds just a whole nother skill set. You can't just freely walk into rooms. If I have a patient that's coding or a patient that needs something breathing, I have to put all that on. It can take about 2 minutes to put that stuff on. So everything's timing there. And then you get a pump that's beeping and you're like, oh God, I was just sitting there. So it's a different aspect. And I can definitely share that with everybody that's out there working, because in today's nursing, I think everybody's required to wear all of these things now. We are not just going in and out freely. Everybody has to mask, gown, glove. For a nurse, it's annoying. You just want to be able to walk in and help your patients. You know, you don't want to have to do all this stuff, but we're keeping ourselves safe and keeping the hospital safe and keeping our patients safe. So. What I'm afraid of is these are going to be the protocols from now on. And it's so rigorous. Is it safety? You know, are we going into the future with all of these things? Are we overboard? Or is this going to be the new protocol? And that's what I'm interested to see how this plays out for the next couple of months. I know that we're going to have a couple more influxes. It's already been predicted through March because of Christmas and all of that. But, you know, I'd really like to see this vaccine work and we get back to normal and treat COVID as we treat the flu. You know, you get tested, you wear just kind of go back to normal. But I think everybody's ready for a little normalcy. You know, I think we've implemented all these policies, so I think that they may stick. The temperature checks at the door. You don't want nurses working sick. The extra protocol for our kids, even going into school. I mean, every day the kids have to wear masks and we have to check on the boxes if they've had fevers or anything. I really don't see that going away anytime soon. And I don't think it'd be a bad thing to implement in our society. I really felt safe there though. I will say that for what they've done is we had all the PPE that we needed. Their protocol was on point. So it was a rewarding experience where I didn't feel unsafe like some of the nurses that are struggling out there. Expect every unit you're going into to be a COVID unit or for you to be floated to a COVID unit. It's just the hospital system right now.